Translocation by Are Thoresen, Chapter 5. To be able to diagnose disease spiritually, we have to enter the spiritual world. Traditional Chinese medicine and the pulse. How to train to do something in the spiritual world concerning transformation and translocation. Our third tool. Traditional Chinese medicine and the pulse. The aspect of pulse diagnosis as part of an acupuncture protocol is complex. Over thousands of years it has undergone a metamorphosis as a result of a division in TCM between two often fundamentally opposed concepts. The first concept revolves around what is termed the eight principle theory. The other field of traditional Chinese medicine that has evolved from a completely different construct is termed five-element acupuncture. In eight principle theory, the principles are bipolar in nature, not Trinitarian, and are guided by what the physician will prescribe as an herbal formula. The patient is evaluated based on the following eight criteria. 1. Is the global picture of the patient yin, interior, cold, deficient? 2. Is the global picture of the patient yang, exterior, hot, excess? 3. Is the disease deeply embedded and chronic, interior? 4. Is the disease superficial and acute, exterior? 5. Is the disease one of excess? 6. Is the disease one of deficiency? 7. Is the disease cold? 8. Is the disease hot? The physician then uses the four examinations, listening, looking, touching and smelling, to determine an appropriate herbal protocol to address the findings. The examination that we shall focus on is that of touch, of which taking the pulse plays a pivotal role. In addition to finding the answer to the above 8 questions, the pulse can also help us to determine the nature of what traditional Chinese medicine calls the 4 fundamental substances critical to the functioning of the organism. 1. The fundamental substance of yin, estrogen. 2. The fundamental substance of yang, thyroxine. 3. The fundamental substance of blood, RBCs. 4. The fundamental substance of fluid, joint fluid. In order to take the pulse, the physician places his fingers on the radial artery of the patient's left and right wrist. Depicted below is the position of where the pulse is taken. Note that the pulses on each wrist have a positional dependence, as each of the practitioner's second, third and fourth finger can access the health of a specific meridian organ. In addition, the pulse will reveal several global aspects of the patient. In this case, the practitioner will check if the pulse is rapid, heat, or slow, cold. Strong impulse versus only slightly perceptible, excess versus deficiency, and more subjective qualities that denote specific organ involvement. This would include a wiry quality, as if you were feeling a guitar string, of a liver imbalance or the rolling action of a spleen imbalance likened to a wave under your finger. With this information, the diagnostician prepares a formula that would address these abnormal characteristics. The other field of traditional Chinese medicine that has evolved from a completely different construct is termed five-element acupuncture. This field of knowledge is based more on the aspects of selecting acupuncture points to balance the patient rather than the administration of herbal concoctions. Basically, the organ meridian processes are placed in categories analogous to the elements found in nature listed as fire, earth, metal, water and wood. This form of acupuncture also requires feeling the pulse at the radial arteries of the wrists, but pays much more attention to the relative strength of each position of the pulse along the line of that artery. The practitioner concerns himself more with where the weakest pulse is found and how it compares to the other organ meridians that are being accessed. This latter technique is the aspect of traditional Chinese medicine that I learned when I studied acupuncture. For veterinary alternative practitioners, attempting to take the pulse on the radial artery of our patient can be problematic. Fortunately, I discovered how to apply the technique of surrogate pulse diagnosis. Adapting the techniques of kinesiology, which recognises that the energy of the practitioner can merge with that of the patient, I found that if I took my own pulse at the relative positions described above and at the same moment contacted the etheric energy of the patient, my pulse would temporarily take on the relative deficiencies and excesses of the animal being examined. The pulse as an exercise towards spiritual development. For those readers versed in these traditional concepts of Chinese pulse diagnosis, the description I shall now present regarding pulse diagnosis will appear quite foreign. In my experience, taking the pulse is a precursor for an initiation into the spiritual world. What I'm about to teach will be especially useful for those alternative practitioners who are acupuncturists, for this can be their way to access the experience necessary to evoke Christ consciousness. When I started to teach pulse diagnosis to my students, I thought that it would be easy for them to monitor the pulse diagnostic patterns in their patients. I thought it was a very simple and straightforward method. Therefore, I was astonished when very few were able to master this technique. At the time, I had no explanation for this phenomenon. I later discovered the reason. The pulse I was feeling was not obtained by my physical senses. The pulse I was looking for was etheric in nature, and its true imbalance could only be found by my spiritual senses. My understanding that I always entered the spiritual world when taking a pulse did not come to my conscious attention until much later in life. Now that we have learned the path to initiation as described by myself and Rudolf Steiner, we can be reminded of the similarities between my path and the method in which I proceed with my diagnostic exam. As I now realise that it is a doorway into the spiritual world, this method will also help us obtain the tools necessary to develop our spiritual organs. The main skill we must learn is the ability to become detached, to enter a state of not caring, not allowing the mind to wander, and not to act other than taking the pulse. In this state, we start to separate, as described earlier in this book. In the beginning, the state of indifference can be difficult to obtain. We are often distracted by a wandering or overly concerned mind. Therefore, we should strive to practice our pulse technique in an environment free of emotional obstacles, such as the judgment of being observed by critical colleagues. Because we are all anchored to the material world by an entanglement of our thinking, feeling and willing, the fusion of the astral and etheric bodies, our primary directive must always be in the forefront of our mind, to master the ability to separate the free soul qualities and/or the astral and etheric bodies. Our mind may very well influence the result of our diagnostic work, just in the same way that the observer may influence an outcome as stated in quantum physics. Therefore, it is necessary that we maintain a neutral meditative state. It might also be a help to try to separate the thinking towards the sky, the feeling towards the periphery, and the willing towards the earth. 1. Thinking equals height, the upward direction towards the cosmos. 2. Feeling equals width, the outward direction, the expanses of our environment. 3. Willing equals depth, the downward direction, as if going into the earth. Using this information, we can use our imagination and blur the delineation of the three dimensions of our physical world. In other words, we practice fuzzy vision by fading away, similar to a daydream where we become unaware of our surroundings, as if in the state just before sleep. Preparation for taking the pulse. Proper pulse taking requires a proper state of mind. This mindset can be described best as a state of daydreaming. When I began to teach the pulse, I urged my students to create the conditions conducive to focused concentration and impartial objectivity. They should create strict rituals. A help in this would be to be immaculately clean and free of physical needs, such as hunger and thirst. The environment required freedom from distractions. For the beginner, it would help to begin with the preparations that I described above. The first mindset one must adapt is a state of not caring. Of course, this first sounds as a kind of therapeutic blasphemy, implying an absence of empathy. Quite the contrary, it represents an emphatic thumbs up to faith. It is the opening of a door to the inward stream of information that the Christ impulse brings to us. Thus, the practitioner must not carry preconceptions of the causes of the disease and shed all interest, anxiety or desire to reach a diagnosis or other prejudicial matter. This stance allows one to live in the exact moment of the pulse and nothing else. Secondly, along with a sort of indifference, the practitioner must stay focused, not mind-wandering. One should concentrate totally and exclusively on the patient. The rest of the world has to be blocked out during this procedure. Finally, the practitioner should not act. This is actually the description of the achieved meditative state, when one seems to fade away, as if he were under the influence of a hypnotic suggestion. These are the qualities that create the alpha wave activity in the brain to increase. In anthroposophical terms, this is referred to as separating the soul faculties of thinking, feeling and willing. In this state of mind, the separation of the mentioned soul constituents should be easy. In my experience, the soul faculty of feeling is the simplest to separate. Therefore, one can start the process by separating width from height and depth. I do this by using the tools of anthroposophical meditative techniques to induce a state of daydreaming where one merges into the wide expanses of the surroundings. Imagine yourself listening to a boring lecture. This is the feeling of fading away. When thinking and willing are separated from feeling, you feel as if you are floating, and you have no strength nor desire to will or think of anything. Often the sense of hearing will be muted by an internal ringing, and the colours of the landscape will darken, taking on a violet hue. Many find themselves subconsciously tilting their heads slightly to the right. It is now at this point that we direct this separated and pure faculty of feeling to concentrate on the blood flowing in our fingertips from the heart and create a deep connection with our patient and his pulse. It is at this point that we are essentially inside the patient. While we are learning these techniques, we must also keep in mind the difference between the laws of the physical world and those of the spiritual world. In the spiritual world, we are not bound by dimension and time. With that said, we can travel vast distances in the blink of an eye. We can move through time as it is no longer absolute. Here, a thought becomes an intention, and an intention becomes a thing. This is the law of destiny as a reflection of our past and present karma. As long as we are in the grip of the entanglement of these soul faculties, we cannot detect the energetic changes necessary to truly heal our patients. There are no shortcuts. Despite the descriptive attempts of the use of psychotropic agents by many to induce this state, these methods often create a false presentment of the spiritual world. The hands as spiritual organs. Another correlation between spiritual science and my development of pulse diagnosis was evident in the lecture given by Rudolf Steiner on August 26, 1912 in Munich. This is what he said regarding the hands as spiritual sense organs. Quote, "The etheric organs of the hands are true spiritual organs. The etheric organs expressed in the hands and their functions work far more intuitively, more spiritually, and perform a far higher task than is accomplished by the etheric brain. Whoever has made progress in these matters will say that the brain, with its etheric basis, is in effect by far the least skillful of the spiritual organs man bears within him." The spiritual activities connected with the organs underlying the hands, but incompletely expressed in the hands and their functions, serve a far higher, more spiritual kind of knowledge and observation. These organs can lead into the supersensible world and can occupy themselves with our perception and orientation there. A spiritual seer may express this, somewhat surprisingly but accurately, by saying that the human brain is a most clumsy organ for research in the spiritual world, and that the hands, or the spiritual basis of the hands, are far more interesting and significant organs for gaining knowledge of the world, and are certainly far more skillful organs than the brain. Not much is gained on the way to initiation by advancing from the use of the physical brain to a free use of the etheric brain. The difference is not great between what may be achieved through purified, intuitive brain thinking and regulated spiritual working in the etheric spiritual counterpart of the brain. The difference is much greater between what our hands accomplish in the world and what can be done by the etheric part that is the spiritual basis of the hands than the physical brain. On the path of initiation, not much development of the etheric brain is necessary, since it is not a particularly important organ. But the etheric basis of the hands is connected with the activity of the lotus flower in the region of the heart, as you will learn in my book Knowledge of the Higher Worlds and its Attainment. This lotus flower pours out its rays of force in such a way as to build up the organism that, at the stage at which physical man now stands, exists in an incomplete form in the hands and their functions. Though it may sound strange, yet it is true that the least skillful organ for spiritual investigation is the brain, since it is the least capable of development. On the other hand, entirely new perspectives are opened out when we consider other apparently subordinate organs." End quote. From the head to the throat to the heart. As the years passed and my skills intensified, I started to develop my spiritual sense organs. The first spiritual organ was the one of sight. I began to see the etheric energy of myself, my patients, and all living things. I could see it connecting between the trees, then among the animals and among the people. In the beginning, I felt that my observations originated from the sensory centre in the back of the brain. I saw that this energy flowed in a downward direction, traversing my arm and entering my fingers to act as a source for both diagnosis and healing as I applied the needles to my patients. But then the centre where the spiritual observations were made started to wander. First it moved towards the heart, then the spine, and then slowly spread throughout the entire body. The observations also became enlarged from an intellectual observation to an immediate knowledge of past, present and future from observing what I was feeling from the pulse. The direction of this observation, which now had become knowledge, also changed. In the beginning, the direction of the information streamed from the patient towards me, but then it started to go both ways, as if the patient also received treatment at the same time as I was diagnosing. The observation also enlarged in space, as it also came to include the astral part of the patient's makeup. This part was seen as a light-flowing area, mingled together with the darker etheric energy. Then the observation started to move in time, to where past, present and future became one. The first picture shown below demonstrates what I spiritually see in the head of a beginner taking the pulse. The soul qualities of thinking, feeling and willing are entangled. In this way, the full process is consumed with daily living, leaving little etheric energy for pulse diagnosis or treating the patient. However, with training, years of practice and correct meditation, the soul faculties begin to separate, allowing the stream of energy from the head to strengthen. This ultimately improves the ability of the practitioner to both diagnose and treat. As thinking, feeling and willing become disengaged from one another, the etheric energy that is centered in the head begins to move downward. This movement is closely linked to the development of Christianity when Christ appeared on earth. This is the movement towards the heart. The 12-petal lotus flower, the etheric heart organ. The lotus flowers, as described in spiritual literature, including anthroposophy, represent the spiritual sense organs of the soul faculties. The 12-petal lotus, in particular, characterizes the makeup of the heart chakra as the center of selfless love, the residence of the Christ impulse, and the eventual source of a vast etheric energy that we can utilize to help our patients. According to Rudolf Steiner, 6 of these petals already exist in us, while the other 6 must be developed by ourselves. The 12-petal lotus, when developed, reveals to the budding clairvoyant a deep understanding of the process of nature and the Christ impulse. Rudolf Steiner says the following about this development. Quote, "When esoteric development has progressed so far that the lotus flowers begin to stir, much has already been achieved by the student which can result in the formation of certain quite definite currents and movements in his etheric body. The object of this development is the formation of a kind of centre in the region of the physical heart, from which radiate currents and movements in the greatest possible varieties of colours and forms. The centre is, in reality, not a mere point, but a more complicated structure, a most wonderful organ. It glows and shimmers with every shade of colours and displays forms of great symmetry, capable of rapid transformation. Other forms and streams of colours radiate from this organ to the other parts of the body, and beyond it to the astral body, completely penetrating and illuminating it. The most important of these currents flow to the lotus flowers. They permeate each petal and regulate its revolutions. Then, streaming out at the points of the petals, they lose themselves in outer space. The higher the development of a person, the greater the circumference to which these rays extend. The 12-petal lotus flower has a particularly close connection with this central organ. The currents flow directly into it and through it, proceeding on the one side to the 16 and the 2-petal lotus flowers, and on the other, the lower side, to the flowers of 8, 6 and 4 petals. It is for this reason that the very greatest care must be devoted to the development of the 12-petal lotus, for an imperfection in the latter would result in irregular formation of the whole structure. The above will give an idea of the delicate and intimate nature of esoteric training, and of the accuracy needed if the development is to be regular and correct. It will also be evident beyond doubt that directions for the development of supersensible faculties can only be the concern of those who have themselves experienced everything which they propose to awaken in others, and who are unquestionably in a position to know whether the directions they give lead to the exact results desired. If the student follows the directions that have been given him, he introduces into his etheric body currents and movements which are in harmony with the laws and the evolution of the world to which he belongs. Consequently, these instructions are reflections of the great laws of cosmic evolution. They consist of the above-mentioned and similar exercises in meditation and concentration which, if correctly practiced, produce the results described. The student must at certain times let these instructions permeate his soul with their content, so that he is inwardly entirely filled with it. A simple start is made with a view to the deepening of the logical activity of the mind and the producing of an inward intensification of thought. Thought is thereby made free and independent of all sense impressions and experiences. It is concentrated in one point, which is held entirely under control. Thus, a preliminary centre is formed for the currents of the etheric body. This centre is not yet in the region of the heart, but in the head, and it appears to the clairvoyant as the point of departure for movements and currents. No esoteric training can be successful which does not first create this centre. If the latter were first formed in the region of the heart, the aspiring clairvoyant would doubtless obtain glimpses of the higher worlds, but would lack all true insight into the connection between these higher worlds and the world of our senses. This, however, is an unconditional necessity for man at the present stage of evolution. The clairvoyant must not become a visionary. He must retain a firm footing upon the earth. The centre in the head, once duly fixed, is then moved lower down to the region of the larynx. This is effected by further exercises in concentration. Then the currents of the etheric body radiate from this point and illuminate the astral space surrounding the individual. Continued practice enables the student to determine for himself the position of this etheric body. Hitherto, this position depends upon external forces proceeding from the physical body. Through further development, the student is able to turn his etheric body to all sides. This faculty is affected by currents moving approximately along both hands and centered in the two-petal lotus in the region of the eyes. All this is made possible through the radiations from the larynx assuming round forms, of which a number flow to the two-petal lotus and thence form undulating currents along the hands. As a further development, these currents branch out and ramify in the most delicate manner and become, as it were, a kind of web which then encompasses the entire etheric body as though with a network. Whereas hitherto the etheric body was not closed to the outer world, so that the life currents from the universal ocean of life flowed freely in and out, these currents now have to pass through this membrane. Thus the individual becomes sensitive to these external streams. They become perceptible to him. And now the time has come to give the complete system of currents and movements its centre situated in the region of the heart. This again is effected by persevering with the exercises in concentration and meditation, and at this point also the stage is reached when the student becomes gifted with the inner word. All things now acquire a new significance for him. They become, as it were, spiritually audible in their innermost self and speak to him of their essential being. Currents described above place him in touch with the inner being of the world to which he belongs. He begins to mingle his life with the life of his environment and can let it reverberate in the movements of his lotus flowers." End quote. Concentration on the heart. Before I take the pulse, I begin by separating and isolating the soul faculty of feeling. I discard my own ego-centered feelings and replace them with a global love for everything. Later, when I consider the diagnosis, thinking, and treatment, willing, I also leave the other two faculties, either feeling and willing or thinking and feeling, and try to use only one of the divine forces. However, when I first enter the diagnostic process, I enter my feeling force through my own heart and concentrate on the heart of the patient. I visualize that I am creating a tunnel or portal between my own heart and that of the patient. I enter this tunnel only with my feeling, leaving both the thinking and the willing outside. In going towards the heart of the patient, I now imagine the 12-layer microsystem of sheaths that begins at the physical skin of the patient and ends in the inside of his spiritual heart. I first picture going through the 8 layers of the body of the patient and then into the 4 layers of the heart, a total of 12 layers. The 8th layer is where we move past the body to enter the 9th layer, represented by the endocardium, and enter the realm of the heart, the spiritual centre of man. In this moment we go from the material realm of the body and into the spiritual realm of the heart. Most students stop before the 8th layer and are unable to enter the heart. It appears that this step requires the presence of a strong and determined will in order to push past this level. It is easiest to understand how to accomplish this if we first learn to visualize these 12 layers of the body as listed below. 1. The outer layer. 1 relate to the physical body. 2. The next, second to the astral body. 3. The third to the etheric body. 4. The 4th parasitic bodies. Note that the parasites situate themselves close to the life energy of the physical body, between the etheric body and the life ether body. 5. The 5th, 6th, 7th, 8th relate to the 4 ethers. 5th to life ether, 6th to chemical ether, 7th to light ether, 8th to warmth ether, touching the pericardium where we leave the material world, and in the 9th layer we enter the spiritual world. 6. The inner layers, 9th, 10th, 11th, 12th, are within the heart and relate to the eye. The lower eye, 9th, the middle eye, 10th, the higher eye, 11th, and the cosmic eye, the Christ consciousness, 12th, where we are in the middle of the heart, the Lamb, Ram, the Christ consciousness. When we are in the middle of the heart, we should imagine standing at a cross. This cross is a little different in a man, a horse, and a dog. On the way through the 12 layers, we may diagnose, experience, and/or treat the different aspects present in these layers concerning diseases or spiritual realities. For example, the 2 outer layers relate to the astral body of the patient. These layers reflect feelings and emotions. If we stop at this layer and take the pulse here, we get an emotional diagnosis. The 3rd and 4th layers both reflect the physical body. The 3rd layer being our own physical body, and the 4th related to the material bodies of parasites that exist within us. If we stop evaluating the pulse at the 3rd or 4th layer, we will be able to diagnose the imbalances present in the physical body. Exploring the pulse at the 4th layer is especially interesting, as here we can detect the presence of both physical and energetic parasites in the body of the patient. The layers where most beginners seem to stop is at the etheric level, located between the 5th and the 8th. This is the location of healing energy of the life force that can be activated by acupuncture and homeopathy. Between the 8th and the 9th layer lies the departure from the physical aspects of the body and the beginning of the spiritual heart organ. I discovered that this region is useful to diagnose the presence of a blockage created by a toxic scar. These particular scars can prevent a successful treatment. I found that when there is no deficiency in the 8th layer and a clear deficiency in the 9th layer, a blocking scar is present. I then focus my intention while taking the pulse at this level to find the exact location of the scar, but later realised that it is possible just treat them using the pulse findings of the 12th layer. Earlier in my career, when I found them, I would inject them with procaine, as described in neural therapy by Dr. Ferdinand Hunick. I now find this to be unnecessary, as I've learned to always treat using the findings when focused on the 12th layer. I feel that the 4 layers within the heart itself are of immense importance. From here we may diagnose and treat diseases from the spiritual realm of the patient. This, in my opinion, is the best option to cure the patient. The inner 9th, 10th, 11th, 12th are within the heart and relate to the eye. The lower eye, 9th, the middle eye, 10th, the higher eye, 11th, and the cosmic eye, the Christ consciousness, 12th, where we are in the middle of the heart, where the Lamb, Ram, the Christ consciousness resides. When we treat from the middle of the heart, we are in the deepest spiritual realm, and here the usual stumbling blocks are gone. How to practice transformation or translocation from our minds schematically. Up till now we have discussed how to pass the threshold, how to open our spiritual sense organs, how to meet the inhabitants of the spiritual world, the phenomenon or translocation and transformation, demons and disease, the tools of homeopathy and acupuncture. Now we describe schematically how to use our mind to perform these tasks. 1. First go into the calm, non-caring, no wanting and no doing mood. 2. Separate one or more soul properties or spiritual parts, especially the etheric from the astral, or the thinking from the feeling, or the feeling from the willing. 3. Pass the threshold. 4. Activate one or more of the spiritual sense organs. Personally, I always use the eyes situated within the physical eyes, not behind and not in front. 5. Observe spiritually the spiritual constituents of the patient, the electromagnetic device or the area containing earth radiation. For this, I usually use a combination of the heart and feeling in connection with the eyes, clairvoyance. 6. While observing the adversarial components of the items in question, activate your willpower. To do this, you have to separate the will from the rest of the body. 7. Let the will stream downwards into the earth, followed by an upstreaming. 8. Meet the upstreaming will force with the intention impregnated thinking, which may be called intention, and let a union of these two streams flow towards the adversarial forces, the earth radiation or the observed demon, and just kindly lead them away, which will be a translocation. 9. Another possibility is to push the two adversarial forces apart, as there always are two forces, one distal and one proximal. In this pushing away, give room for the entering of the Christ force, the Christ consciousness. 10. In leading them away, translocation, or in starting a transformation in the name of Christ, also fill your soul with a compassion and mood of asking excuse for having made the divine powers into adversarial beings by our deeds.